We're now going to talk about why reviewing your group benefits is so important. So, Dr. White, when you first started out, when it comes to the group benefits, what were the things that you believe were most important to have in the group benefit space? And, why was that?
So, like most doctors, I had a relatively limited amount of education on ways to protect income and assets through the period of medical school. The benefits that I was familiar with are the standard basic group benefits like term life insurance, disability insurance, and of course, health, vision, and dental insurance.
Okay. And, when you were actually going through the process of being in the field and, actually practicing, how did you enact those benefits? Did somebody help you out there? Did you have education on them before you elected those benefits? What actually, led you to putting those benefits in place?
So starting a practice obviously involves a lot of different components. And to be frank, benefits were relatively low on the scale of what I was really taking the time to evaluate. So for the most part, I just went with what most doctors would. The standard group benefits either offered through my previous employer when I was working or in private practice, group benefits that were offered through the American Dental Association or a local medical or dental association.
Okay, and when you actually began your own practice, looking back on it now, is there anything you wish that you did differently about your group benefits at the time that you would change?
Yes, absolutely. I think it's important to review them carefully with a professional to understand not only what you have, but also what you're missing. Because of the limited amount of education that we get on this type of information, we tend to miss things that we're not even aware of. So going back, there were definitely some holes in my coverage that I discovered later, unfortunately, that I wish I had a chance to review and act upon before that.
Awesome. Thank you so much.